Sinai isn't the only hospital taking precautions. Here at home, hospitals aren't taking any chances when it comes to the possibility of an Ebola case popping up in Connecticut.
Fox Connecticut's Tony Terzi joins us now with the doctor from Hartford Hospital. Tony.
Allison, Javon, even though the Connecticut Department of Public Health says there are no suspected cases here in state, Dr. Jack Ross, the chief of infectious diseases at Hartford Hospital, certainly paying close attention to the situation. First off, have you been to West Africa, to any of these nations?
I have not at all, Tony.
Okay. Have you been in touch with Mount Sinai, since it's close to home, to...
We haven't. What we have done is we've been on a conference call with the CDC today that occurred this afternoon from 2 to 3, where they provided the current information about what is known about the cases in Africa and the precautions that they are recommending.
Now, people here in Connecticut, of course, doctor, want to know what measures is Hartford Hospital taking to help prevent an outbreak here in the state?
First of all, the risk to the American public is essentially zero from Ebola. But what we are doing to be vigilant is we have changed our triage procedures in the emergency room. If someone were to present with a history within the last 21 days of travel to West Africa with a fever and some of the symptoms of Ebola, at that point they would be triaged to a room where they'd be put on what we call droplet and contact isolation.
Okay. What exactly is Ebola? I understand it originates perhaps from the fruit bat?
It may actually be transmitted by fruit bats. That's still unknown, but that's a possibility. It's a filovirus or a hemorrhagic fever virus. First described in 1976, and there have been a number of limited outbreaks, usually in rural areas in Africa, since that time, Tony.
Okay. Now, for folks who visit West Africa, how do you find out if they've visited West Africa? Do you ask everybody that comes into the hospital?
It's a great question. What you do is in your electronic medical record system or triage system, if you present, you might ask, much like we do for MERS, have you been to the Arabian Peninsula the last 2 weeks, or have you been to West Africa in the last 3 weeks, or had contact with someone who may have been there?
Okay. Now, these aid workers in Africa, they are taking an experimental drug. What do you know about that drug?
We don't know much, and even as of this afternoon, the CDC really did not have any information about that. It's called a serum. In the past, they have used various anti-serums for diseases prior to the antibiotic era, such as even pneumococcal pneumonia. So it may be based on that, or it may be some combination of other elements we don't know right now.
Of course, the CDC needs to approve, or the FDA needs to approve any drugs that are used here in the United States. So could they be administered, these drugs, again here in the United States?
They definitely could if they have the ability to produce this drug out in San Diego at the company that makes it.
Dr. Jack Ross, keeping an eye on the situation here in Connecticut. I know because it's close to home in New York City, even though they said it's highly unlikely that patient has Ebola, still something we're going to keep our taps on. And we do appreciate you coming by.
Thank you, Tony.
All right. Allison, Javon.